What if I told you that missing a single date on your calendar could cost you thousands in healthcare expenses? Or that the government gives you a chance to potentially save thousands every year, but most people miss it? Today, I'm breaking down Medicare Advantage and Part D plans, and the enrollment windows you absolutely cannot afford to miss. Hey everyone, if you're approaching 65, caring for someone who is, or just want to understand how Medicare really works, this video is going to save you major headaches and potentially thousands of dollars. Let's dive into Medicare Advantage, Part D, and the critical enrollment periods that can make or break your healthcare coverage. First, what exactly are these plans? Original Medicare, Parts A and B, covers hospital and medical services, but leaves gaps like prescription drugs, dental, vision, and more. Medicare Advantage plans, also called Part C, are offered by private insurance companies approved by Medicare. They bundle Parts A and B coverage, usually include prescription drug coverage, and often add extras benefits. Part D plans are standalone prescription drug plans for those who keep original Medicare but want drug coverage. Without one, you could pay full price for medications, which, trust me, can be financially devastating. Now for the critical part. When can you enroll? There are 4 main windows, and missing them can leave you with gaps in coverage or permanent penalties. First is your initial enrollment period. This 7-month window centers around your 65th birthday, starting 3 months before your birthday month, including your birthday month and extending 3 months after. Miss this, and you could face late enrollment penalties that last forever. Second is the annual enrollment period, from October 15th through December 7th each year. This is your yearly opportunity to join, switch, or drop a Medicare Advantage or Part D plan, with changes effective January 1st. Third is the Medicare Advantage open enrollment period from January 1st through March 31st. If you're already in a Medicare Advantage plan, you can switch to a different one or go back to original Medicare during this time. Finally, special enrollment periods are available when certain life events happen, like moving, losing coverage, or qualifying for extra help. These are your safety nets if your situation changes. Why am I making such a big deal about these dates? Because the consequences of missing them are severe. The late enrollment penalty for Part D isn't calculated as a percentage of your specific plan's premium. It's 1% of the national base beneficiary premium for each full month you delay enrollment without other creditable coverage. And this penalty lasts for the rest of your life. And don't forget about the Part B penalty. If you don't sign up for Part B when you're first eligible, you'll face a penalty of 10% of the standard Part B premium for each 12-month period you could have had Part B but didn't. And like the Part D penalty, this one is permanent too. Plus, if you miss these windows, you may have to wait months with no coverage until the next enrollment period opens. Imagine paying full price for that expensive medication or postponing needed care because you missed a deadline. So what should you do now? First, mark these enrollment dates on your calendar or set reminders on your phone. Second, start comparing plans before your enrollment period begins. Or consider working with a licensed agent who can guide you through the whole process. They can help you navigate your plan options and assist with your enrollment at no cost to you. Practically, they do all the research for you. And finally, reassess your coverage every year during annual enrollment. Plans change their coverage and costs annually. If you found this helpful, hit like and subscribe for more straightforward Medicare guidance. Drop your Medicare questions in the comments. Let me know if you need help.